Hello out there, it's the Einstein Surfer coming at you with some developments in the world of Medicare Advantage prior authorizations for skilled nursing facilities. Before I dive into today's topic, I need to clarify a few terms I'll be using as we go along. The word SNF, you're going to hear me say that a lot. SNF basically is from the acronym or abbreviation SNF, which is Skilled Nursing Facility. So you're going to hear me say the word SNF a lot, and it basically just means skilled nursing facility. ADL or ADLs, that is short for activities of daily living, and that encompasses a number of levels of activity that is used to determine many things. Bed mobility, turning side to side, sitting up in bed, the transition from sitting to standing, from the ability to walk, the assistance needed to get dressed, to feed themselves, or to use the toilet, just a few ADLs. The patient's ability to do those things and how much assistance is needed from healthcare personnel is carefully measured and documented by pretty much everybody in the SNF. Physical therapy, occupational therapy, nurses, CNAs, they're all highly trained in this, and it is a crucial part of what we all document. And that information is used to determine a great deal of the care that the patient receives. It also determines whether or not the patient gets approved and remains approved during their stay in the SNF. So that information is extremely important, it's crucial, and they all work very hard to get it right so that we can report it as accurately as possible. There have been a great deal of changes in Medicare and Medicare Advantage over the past few years. But just like everything else with the government, change usually isn't fast. They change the rules all the time. Typically every single year they have a great big set of rules that they change and implement that take effect, that year, the next year, it can be several years. Of course, it's the government. So in early 2023, an article or a series of articles were published in leading online magazines regarding an alarming increase in the pre-authorizations being denied for inpatient skilled nursing facility stays. And that brings me to today's topic. I can tell you that categorically across the entire spectrum of Medicare Advantage providers that I work with, that all of the SNF pre-auth requests have undergone a major overhaul since we've emerged from the COVID pandemic. Those changes actually started to leak out to us during the COVID pandemic, as most of the pre-auths had been sort of suspended, for lack of a better term. During the peak of COVID, pretty much all the Medicare Advantage providers stopped requiring us to get an actual authorization, ostensibly to make room for the dramatic increase in COVID patients in the hospitals. And that was a feeding frenzy, not by us or the other facilities, because our census actually went down during peak COVID, stayed down. The hospitals wanted the SNF patients the hell out of the hospital. They got paid a huge amount more for patients that they could diagnose with COVID, far more than mom or dad with a hip surgery that needed to come to a SNF. We were under huge pressure to get them out, and the hospitals lobbied state healthcare agencies, who in turn pressured Medicare, and they in turn pretty much got all of the insurance companies that provided Medicare Advantage to issue what they called COVID waivers, so that the authorization could be done after the patient discharged from the hospital. Actually, they did that twice, right when COVID was peaking the first time, and then we went back to sort of a normal operation, and then again when the next peak hit during one of the variants or whatever, and then back to normal or the new normal. And that was just a mess. And my contacts within the insurance companies, the prior authorization nurses that I routinely work with to get these authorizations done, they all started telling me that changes were being worked on and would be rolled out whenever they started going back to doing the mandatory pre-authorizations, as they had been doing before COVID. Well, they weren't kidding. A number of the Med Advantage companies have moved to what we call third-party vendors or third-party administrators to do their inpatient skilled nursing facility authorizations, which means that they've contracted with different companies, and those companies handle all of the SNF pre-auths. This is a blessing and a curse. Each of the third-party vendors uses their own way of submitting these requests. They pretty much all have their own separate web portal for me to use, and they're all the same but different. The only thing that's actually the same is the type of clinical information that we have to use and submit along those requests. That determines whether or not they get approved, and that's a Medicare guideline. Some of these third parties are very fast, others not so much. Some of them use an artificial intelligence and AI algorithm that in some instances can grant an instant or near instant approval. That depends on the clinical information that I used to enter the authorization request into their respective systems. Otherwise, the case is assigned to a nurse reviewer, an actual person, which is the way it was always done before, who goes over the clinical information and either issues an approval if the parameters are met, or they call me and message me to ask for more details all the time. The case will then be routed to their medical director for a review, a physician or a mid-level practitioner, a nurse practitioner, that sort of person. If they can't approve with the information that they have, then it's either an outright denial or what's referred to as a peer-to-peer review, which is a discussion between the Medicare Advantage medical director and the hospital attending physician or mid-level practitioner. The case is then approved or denied. Not all Medicare Advantage companies offer a peer-to-peer before it's denied. It's, like I said, it's the same but different. If it's denied, they almost always provide an option for the patient to appeal the decision, which they very often do and win. And when they get it overturned, then we're able to, of course, admit them, and then we take over the process. And that's where those ADLs come in from our people in our facilities. But we have seen a huge uptick in denials across the various Medicare Advantage providers, and that's a fact. I will say, without naming any specific companies, that I know that I have at least about a 50% chance of an initial denial or a peer-to-peer with a couple of these companies at least, probably more than a couple of them. Some of them deny at far lower rates, some of them deny hardly ever, and some of them deny quite frequently, and there's really no rhyme or reason to it. But I can tell you, with the companies that I deal with, I'm pretty much, I can predict, what's going to happen just because I work with them all the time. I mean, it's very noticeable to me, and I do a lot of these. I'm afraid what's already started to happen is that many of the Medicare Advantage companies are using artificial intelligence, and a lot of the ones that I get approved quickly are because all of the boxes are checked. Knowing what I know from my time working on the Medicare side of things, I know pretty much what is a guaranteed approval. I know what they're looking for. Not to say that I put it in there just because I can. I still have to, be ethical about it and truthful, because my nursing license is on the line here. The right diagnosis coupled with a decrease in the ADL of 2 levels or more is almost always a slam dunk approval. So the algorithm, AI, whatever, will approve these almost instantly, as will a human reviewer. Not as fast, but still quickly, which they should, in all honesty, because that is nearly the definition of what Medicare says it takes to be able to admit them for a sniff stay. So the way I see it, the Medicare Advantage companies are trying to use a more AI-based approach with an impersonal algorithm to determine how much care a patient needs. My contention is that we need a more human-centered approach on most of these cases. I'm afraid that the economics are in the way of what's best for the patients. There are a lot of denials and appeals, but it's not always cut and dried. AI will never be able to look into a patient's eyes, never be able to listen to the tone of their voice, never be able to get a sense of what's going on with that patient like a human. So yes, we are seeing a huge increase in denials, and even more of an increase of these insurance companies demanding updated clinical information after the auth request has been submitted. That takes up a lot of time because they want more, they're looking for a reason to deny. All this causes delays in approvals. And if they see the patient improving too much during this time, they'll often deny it, saying that the patient looks closer to their baseline. So time is of the essence, and we need to get it right the first time. So the government's answer to this is, as always, is to pass another rule, which is to say an amendment to the criteria governing the Medicare practices, which is also to say that this is making it even more complicated to get these patients that aren't cookie cutter with all the right boxes checked approved. It's more important than ever to me that real humans with a nursing or therapy background remain in control of gathering the clinical information and deciding what does or does not meet these guidelines. I mean, seriously, do you want the Terminator deciding whether or not you or your loved one gets medical care? I don't. Anyway, that's where we're headed unless we lobby Congress to stop it. These insurance companies that provide Medicare Advantage are in business. The skilled nursing facilities are in business. These patients that need the care are the ones that stand to lose the most. And even though I'm an advocate for all three of these, my main focus is seeing that the patient's needs are met. In my personal and professional opinion, the best way for that to happen is for an actual human being to be the one directing the prior authorization process. It's more to me about the people than it is about checking the boxes and making sure that you pander to the algorithms that these companies use. So even though I do work for a skilled nursing facility company, my main focus is making sure that the patients get the care they need, the care their insurance and Medicare Advantage are supposed to provide, as a matter of fact. My particular company supports this philosophy 100%. Even if we lose the admission, which is money, at the bottom line, we want to make sure that we're only doing what the patient actually needs rather than what we can pile on and just make money off of. So going forward, I'm going to try to bring you guys some videos that give anecdotal scenarios from my perspective that show some of the obstacles I deal with daily. I'll walk you through the process from dealing with the hospitals that want them out now no matter what, to the insurances that drag their feet, repeatedly ask for updates so they can either deny it or prepare for a quick short stay in the SNF, which may or may not be what the patient needs. So anyway, if you have any questions, leave them in the comments below. And if you like what I'm doing, please remember to like, share, and subscribe. Hit that notification bell so you won't miss any of my riveting content. And the Einstein Surfer is out.